Anesthesia departments are facing major challenges. Patients are presenting with higher risk profiles. Anesthesia's staffing reductions are ongoing, and documentation requirements are increasing. How can your anesthesia department manage complex cases, improve patient outcomes, and reduce the administrative burden? The answer lies in digital innovation. Centricity High Acuity Anesthesia is designed for today's challenges in perioperative care. It's as easy to use as paper charting, but offers the quality and productivity advantages of digitization. Let's see how easily Centricity High Acuity fits into your OR workflow. You meet with patient Will Baffin before his surgery to go over his history, medications, allergies, and anesthesia plan, and explain the pre-op preparations. Centricity High Acuity Anesthesia supports the pre-op assessment with structured documentation, including visuals such as Mallampati and risk assessment scores. This patient has a higher risk for post-operative nausea and vomiting. Prophylactic antiemetics is planned. At the start of your shift in the operating room, it's time to review the anesthesia schedule and assess resources, plan procedures, anesthesia techniques, and patient status. All of the pre-op data is right at your fingertips. The WHO safety checklist can be included in your workflow, as can other checklists. Centricity High Acuity draws data from medical devices, labs, and hospital information systems. You see relevant, actionable information without the heavy documentation burden and can be presented in landscape or portrait mode. You can document pre-configured induction medication and fluids quickly and easily. Timed events such as patient in OR and start of surgery and incision are easy to document through the work list. The monitor alarms for a sudden drop in blood pressure. 2 minutes ago, you administered 1 milligram of phenylephrine. Retrospective documentation is easy. Built-in clinical expertise supports adherence to hospital guidelines such as lung protective ventilation. Notifications like this signal when your attention is needed, so you can intervene promptly. Surgery was completed successfully. Documenting a predefined set of post-op instructions is efficient and included in the patient record in recovery. Due to the higher risk for PONV, the prophylactic antiemetics are continued. Data from Centricity High Acuity can automatically be exported for billing purposes or for benchmarking purposes in national quality registries. From the OR to the recovery to the ICU and beyond, Centricity High Acuity provides a single patient record showing all the data entered during the perioperative process and integrating with the hospital EMR. In recovery, Centricity High Acuity gives staff access to the entire anesthesia record. They can see the post-op instructions, and scores are automatically calculated, saving time and reducing errors. Centricity High Acuity data is available for clinical research and quality analyses. For example, the Operational Efficiency Dashboard and End Tidal Control Cost Efficiency Dashboard provide deeper insights. Lung protective therapy can now be monitored across the anesthesia and ICU departments to determine how many patients received optimized ventilation. Hospitals across the globe are improving outcomes with Centricity High Acuity, reducing medication errors up to 84%, providing better patient care, and optimizing clinical time by 28 hours per week. As easy as paper charting, but offering the advantages of digitization. Centricity High Acuity Anesthesia helps to enhance clinical decision-making throughout the perioperative workflow. Centricity High Acuity Anesthesia, helping to enhance clinical decision-making throughout the perioperative workflow.